The views and opinions expressed on this show are those of the authors. Any content provided by our bloggers or authors are of their opinion and are not intended to malign any religion, ethnic group, club, organization, company, municipality, individual, or anyone or anything.
He's a surgeon. He's a 100-ton boat captain. He's a lieutenant on Seaside Heights Beach Patrol in New Jersey. He's a member of the Coast Guard Auxiliary. He's Dr. Michael Kachmar. Need answers to your medical questions? We have them. Listen in to hear latest on medical topics related to all that and more.
Hello, everyone. This is Dr. Michael Kachmar. Welcome to Scrubbing Up with Dr. Michael Kachmar. Yeah. Let's start the show today. We have a lot of really interesting things. Let's go to my whiteboard. And so here's our whiteboard. And the first thing we're going to talk about today is Canada's assisted dying proposed legislation.
Now, when Mike brought this up and put it up, actually, when he put it up on the board and I saw it, and I was like, oh, wow. I actually saw I think it was Tucker Carlson who brought it up on one of his shows a few weeks back, where Trudeau was trying to push for this assisted dying thing. But the ridiculous thing is, it's just for people who are down. You know, maybe they're suffering depression. So rather than actually get them hope or, you know, give them maybe a treatment for that, they can just die. You can get them if they're sad enough. So if your son broke up with his girlfriend and he seems to be completely devastated, it might just ruin his whole life. You can get him euthanized with very little questions asked.
Right. And let me give you some perspective on this, because we're going to, right after this, we'll talk about how the Nazis perfected the Nazi euthanasia.
This is where it's from.
They had a Department of Euthanasia, but this is how it starts. It's been around for a while.
Nobody just came up with this idea in Canada. This is a practiced sort of thing. Yeah.
It sounds good, but I think Jeremy's you gotta be careful hitting the table. I think what happens is that let's not pound yet. That's the German, Russian.
Yeah, that's me. If you start hearing like really unruly bangs and stuff, you know I'm upset.
All right, so let's look at this little video here. This is let's go to the videotape, please. And this is a little YouTube video we're gonna put here. So I'll start here. I just want to preface. So this says concerns over changes in Canada's assisted living. So listen to this real quick.
Psychiatrists are trained to deal with people in crisis. But some are now having their own crisis of confidence when it comes to medically assisted dying.
Our role as therapists, as psychiatrists, is in suicide prevention. And so to ask us to then facilitate suicide is very dissonant.
The laws around medical assistance in dying, or MAID, are set to expand, including Canadians with mental illness. But medical experts across the country warn Canada's healthcare system is not ready.
And we already know there's not really clear consensus on a definition of, for example, what it means for someone to have a mental illness that is incurable or irremediable. So we already know there's this risk of inconsistent application of MAID.
When MAID became legal 7 years ago, only patients with a terminal illness were eligible. In 2019, a Quebec judge ruled this restriction was unconstitutional, so Parliament amended the bill.
In my view, mental illness is no different than any other medical illness. I believe that doctors are quite capable of assessing people with psychiatric illness and coming to the same conclusions that they have for people who have, cancer or
you kidding me?
Disease.
All right, stop it. Stop it. Take this guy off. Take this. Now, let me just make a point here. What they're proposing in Canada is expanding the euthanasia, which they have already. They'll off people, and they do this in Europe. They call it suicidal vacations. You could go on internet, and there's documentaries made about it. It's called Suicide Vacation. Basically, you go to one of these really extreme progressive countries, and they'll put you to death. Here's what he's saying. A couple things. I just want to make a point here. He's saying that, first of all, a doctor should be able to make the decision whether or not you should die based on not just if you have terminal illness, but mental illness. And if you have mental illness and a doctor, which is going to be probably paid for the service of killing you or by the state, because all the doctors up there, I think, work for the Canadian government, they're going to make the decision. And he says, "Oh no, it's the same. Mental illness is the same as having cancer." So we have centers right around here. They're assisted living homes with people who are schizophrenic, and we're gonna off them. My point is, Germany had it. They perfected it. They started with children. First of all, if you were born deformed, they would dispose of you. If you were too old, they got rid of you. And there was clinics where you would go.
Mental retardation.
Everything. Well, but even like a shattered limb, you know, they would say, listen, we're going to, because they didn't have the way to fix it, they would just.
Like I had a teacher, a third grade teacher, who had one arm that was all shriveled up.
Right.
You know, like like
Get
a
rid
dinosaur.
of them. Right.
She'd be gone. She certainly wouldn't have been a teacher.
No. And so Nazi Germany took this to a very high level. They actually had a department of euthanasia. Of course, down the road, what they did is they incorporated the euthanasia department to take care of the Jewish problem. Yeah. Because if you really look at it, if you read the history of what went on in the concentration camps and the execution of these people, it was military, but they had doctors there. You would come in, and the doctors would check you out, and they would decide whether or not you're going to be gassed right off the bat or you're going to work for a while. It was a medical... precise medical organization that was dealing with that. And people don't realize that. That's why we talk about medicine here. This was a combination of good intentioned people in the beginning saying, well, you know, maybe we could help people die if they're, you know, they're terminal. And this is where it goes. Human nature is very hard to put the brakes on it. Canada is going down a very dangerous road here because you make a good point. In Russia, right, or these other places, when you talk about mental illness, how many people are locked up in gulags with Stalin and Mao because they considered you mentally ill? Yeah. And what is mentally ill? Well, if you don't agree with me,
so
if
now
you don't,
they can free up space.
I can tell you what's mentally ill. I'll give you a good example. If you don't believe in abortion on demand at 9 weeks, 9 months.
You must be crazy.
And then you know, why a 12-year-old girl?
This guy's out of his head. Let's get, you know.
Right. So you must be crazy. And we have to. So let's go back to the video. I want to show you now. This is a little video.
You ever see Chitty Chitty Bang Bang?
Yeah.
You know the candy guy that lured the kids in? We send the guy out like that to get the depressed people.
All right. So let's put this. Just go back to my my iPad here. Let me just throw this up here for you.
So in this video, we're going to look at the
euthanasia.
radicalization of racial policy towards Nazi euthanasia and the euthanasia programs. Okay. And this is sort of generally on our sort of journey to go from where the Nazis began with their sort of blatant anti-Semitism, correct, all the way to their genocidal tendencies, effectively. Okay, so this is really what we're trying to get at. Okay, and one point is Nazi euthanasia. So we're going to take a little introduction, and then we're going to look at the main instrument of the Nazi euthanasia program, which was called the T4 program.
T4, okay. And listen to this. This is interesting.
Generally, Nazi euthanasia is part of the sort of Nazi ideology. So Hitler believed that people of no value to the state should be exterminated by the state. So this is again part of sort of general Nazi ideology. So Nazi ideology here. Okay, so I'm spelling words correctly today.
See, if you look here, it says ordered midwives and doctors to report to the right committee all infants.
A strong case that much of society did agree with Hitler.
Hear this? Okay, they thought it was a good idea.
Maybe not so much as. So there was sort of a difficult situation within German society. People had the belief in
see if you can
euthanasia.
We're just testing our make sure you could hear us, Jeremy.
The idea of actually putting it into practice was still relatively controversial. Okay, so as a result, there was.
Let me just point to one here. If you look at this thing here, it says now this was much of the society agree with this because it was low key, you know, in the beginning. But look at what it says here. August of 1939, a decree ordered midwives and doctors to report to the Reich Committee all infants. The people believe all infants that were born. You can't see it here. I'm going to say. Well, let me move this here. I got to see. Let me just see if I get it here. It's being blocked here. I'm sorry, I can't see it. It's I guess it's on his end. But if any infants were deemed would die or not be survivable or have some mental issues. And then people believed this was for research purposes, but in reality, it was used to determine who would die. Let me just put it back here.
For those who
plans for euthanasia programs. So there was an organization called the Reich Committee, which was set up to try and hide euthanasia activities. Okay, so this was sort of a smokescreen. So this was a smokescreen to hide euthanasia activities, because again, society and especially the Catholic Church at this point sort of it was still relatively controversial. And in August 1939, think about how late it is that Nazi euthanasia is even happening. So 1939, the Nazis came to power in 1933. Hitler sort of expressed an ideal for euthanasia as early as 1934, and they waited till 1939 before they started to bring things into pass. Okay, so a decree in 1939 ordered midwives and doctors to report to this Reich Committee, okay, all infants that were born with serious medical conditions. This is the groundworks for the euthanasia program.
See, it started gradual.
And people believed that this was for research purposes.
Yeah, they were going to die anyway, right?
They were hiding the facts, so they were hiding their true purpose.
And this is the big fear about the whole thing. This right here.
Yeah. Wait. We'll leave it when just finish.
Okay. In reality, it was to determine who would die. Okay, who should be euthanized.
This is children we're talking about, not even the Jews
so those who were
older
children
people
to die were taken to clinics where they'd be either overdosed or they were just left to starve to death. Okay, and this method was used to euthanize around 5,000 children between 1939 and 1945.
Okay. So let's go back to me. So I want to make a point here. This was
before we switch though. I want to just say that first sentence: Hitler believed that people of no value. I mean, that's a very broad statement.
And there's no sovereignty there. Those people had no sovereignty, right, Jeremy?
No sovereignty.
Now he was a dictator, and I can tell you, I want to make a point.
They didn't even know the word.
There's no difference between a socialist dictator and a fascist dictator, and you lose your rights. And now, what do you have in Canada? Is you have, I'm not saying he's a dictator, but my point is you have a person, a people, a government.
I think he's running for dictator, though. That's what he's trying. That's what he's moving toward.
You have a government. Let's go back to white people. The Canadian government wants to have put people to death. The government's going to pay for it. The doctors are going to do it. If you have quote unquote mental illness,
right?
And it's this is what's next, Jeremy. If we don't like your politics, or